Thank you very much, Ms. Makanya. The Honorable Deputy Minister, Dr. Joe Pasha, all the MECs in the different provinces who have joined us today, the heads of departments, members of the media, and last but not the least, the nurses, the midwives of South Africa, the continent, and the world, and fellow South Africans. We are here today to honor the men and women at the front line of the healthcare, the nurses and the midwives. The critical role that the nurses play in protecting and caring for our communities cannot be overstated. In many ways, they are the face of our healthcare. Today marks the birth of Florence Nightingale, the foundational philosopher of modern nursing, who was born 200 years ago. Florence, also called the Lady with the Lamp, was called in 1854 by the Secretary of War to organize a corps of nurses to tend to the sick and fallen soldiers of the Crimean War. In South Africa and across the African continent, we also remember our pioneer, Cecilia Makiwane, on this day. On the 7th of January 1908, Makiwane became the first black woman on the African continent to be licensed as a nurse. Born in Alice in the Eastern Cape, Makiwane lost her mother at an early age and was raised by her father. She studied as a teacher first before discovering her calling in nursing. As an early activist for women's rights and in the anti-pass movement, Makiwane is remembered for her indomitable spirit and her unwavering dedication and commitment to the nursing as a craft. Today, Makiwane's memory reminds us of our strong legacy of black excellence in the profession, which we must continue to advance in everything we do. We also remember the 20 nurses who heeded the call from Tanganyika and made a voyage to Tanzania in 1961, at a time when the country faced a nursing crisis after the British rule ended. 2 of those nurses are from this province of KwaZulu-Natal, the late Edna Mia, who worked at King George, and Sister Cecilia Ntomenhle Khuzwayo, who is now 83 years and worked at King Edward at the time. We salute you for being ready to serve the diaspora. As a department, we recognize the need to prioritize the nursing profession along with the well-being of the nurses and strengthening nursing education, training, and practice is one of our strategic objectives. Regrettably, our war against the COVID-19 epidemic has cost us lives of our health workers. On behalf of my department, I would like to dedicate this day to all our nurses, especially those who have lost their lives in the pandemic. Their contribution to the fight against the pandemic is immeasurable. Many of their families and loved ones find strength. May their families and the loved ones find strength in the shared memories, and may their souls rest in eternal peace. In 2019, the World Health Organization designated 2020 as the year of the nurse and the midwife, in honor of the 200th birthday anniversary of Florence Nightingale. The year 2020 is significant for the WHO by recognizing the critical role nursing and midwifery play in strengthening the universal health coverage. The plan for 2020 is to improve the public's understanding of the contributions nurses and midwives make in the societies they live in. The global epidemic calls for a different approach to celebrating nurses, the real leaders of the world to health. We will listen as our nurses tell us their stories under the theme, Voice to Lead, Nursing the World to Health. I take this opportunity to commend all the nurses in our country for your contributions to the health and well-being of our nation in general, and your efforts in the combat against the pandemic. For most of our communities, the nurse is the first to be seen at the time of birth. The heartbeat of the health system throughout the lifespan, providing preventative, curative, rehabilitative care, and often the last to help close our eyes at the time of the end of life. In a book entitled, and I quote, Divided Sisterhood, Race, Class, Gender in South African Nursing Profession, Shula Marx argues that the nursing service in any country provides a lens through which one can gain an understanding of the dynamics of the interplay between the context of care, the provider of care, and the recipient of care. The COVID-19 epidemic is a case in point. As the whole world is called to wage a war against COVID-19, our nurses, consistent with the theme of the International Year of a Nurse and Midwife, individually and collectively, as members of the epidemic response team, have given their all in the various stages of our response from community to facility level. Your compassion and your kindness as you listen and allay the fears and the anxieties associated with the scary news of testing positive to COVID-19 infection does not go unnoticed. Your compassion and comfort to patients who cannot be with their loved ones at the bedside through the journey of the COVID-19 is the best gift to our patient, a gift no amount of money can buy. As you nurse our communities during the pandemic, your personal touch is more palpable, as you provide a broad range of essential health services, ranging from administering oxygen therapy, ensuring the patient is in the best position for optimal lung function, and by being the only health professional privileged to hold the hands of those who succumb to the unseen enemy of our world. Of the 18 million or more health workers required to achieve and sustain universal health coverage by 2030, almost half of the shortfall are nurses and midwives. The International Council for Nursing warned of a potentially catastrophic shortage of nurses over the next decade and urged governments to act swiftly to turn the situation around. I'd like to commend South African National Coronavirus Command Council, led by our President, His Excellency Cyril Ramaphosa, in cooperation with the National Minister of Finance and Treasury, who urged all provinces to fill the frozen and vacant posts that are required at all levels of care for the duration of the pandemic and beyond. I'm aware that all provinces are finalizing their recruitment for both the day-to-day health services as well as the capacity for case management during the anticipated surge of the pandemic. While the pandemic has magnified the cracks and exposed the impact of unequal distribution of resources between the public and the private sector, we are resolute in ensuring that all health professionals are provided with the appropriate personal protective equipment and the requisite tools of trade. As we celebrate our nurses and midwives, I'd like to affirm our commitment to ensuring that no nurse will be allowed to care for patients without appropriate protective equipment, be it at a community level, during screening and testing, or in the health facility. While the nurses have always worked under intense psychological pressure, the current pandemic is making an extraordinary demand on them both physically and mentally. Whilst it is understood that over time the threat of the infection will reduce, we also know that the mental health impact of the crisis will remain. Retaining and supporting the nursing workforce requires a focus on promoting and protecting their physical, mental, and spiritual well-being. We are committed to support them to deal with any immediate physical and mental health issues and prevent some of the mental health consequences that may not be apparent now but may emerge in the future. In this regard, we have prioritized the development and implementation of the comprehensive program for caring for the carers. Through this program, our frontline health workers would be provided with a safety net across the continuum of care. We would also like to commend our social partners who have extended support specific to our nurses during this difficult time. The health system's claims to resilience stems from a resilient workforce. No matter where you are or what area of nursing you work in, you can and do make a difference to the public that you serve. Thank you for all that you do on a daily basis. It takes courage to be a nurse, and in the words of Mary Ann Redmatcher, I quote, "Courage does not always roar. Sometimes courage is the quiet voice at the end of the day saying, I will try again tomorrow." Within the nursing fraternity, I'm aware that a number of slogans for the year of the nurse were framed to celebrate their own, ranging from #BeThatNurse, or #NurseForLife, or #Nurses Saves Lives, or #Once a Nurse, Always a Nurse. All of them remain appropriate to capture the spirit of dedication that the nurses have demonstrated in caring for our nation. In appreciation for your services as government, we undertake to give you the adequate training, ensure sufficient protection, and appropriate recognition of your contribution in the service to the nation. To all the nurses of South Africa and the world, we say a big thank you for carrying the burden of COVID-19 outbreak and serving humanity. We appreciate the choice you made to carry the burden of saving lives during the weakest moment in our journey on earth. We salute you for the professionalism with which you execute the nursing art and provide the backbone of our health services. We salute you for your caring heart and the warm smile that eases the pain and heals the suffering. We salute you for being the source of hope and strength in the dark days of hopelessness and ill health, and often being the last to hold the hand and close the eyes on the last moment that concludes our final chapter on earth. We salute you for your dedication and selflessness with which you give your all to serve the others. We salute you for your caring spirit of Ubuntu. South Africa salutes you and thanks you sincerely. May God abundantly bless you and reward you and give you the strength and peace. Nurses of South Africa, I salute you. God bless the nurses and God bless South Africa. Thank you very much.